Hello, nurses. Today's discussion is about a few very important MCQs from diabetes mellitus. So, the first question is, while taking care of a patient with diabetes mellitus, the nurse knows that one of the following symptoms do not present in hyperglycemia. Option A, extreme thirst. Option B, hunger. Option C, numbness of the tongue. Option D, glycosuria. And the answer is numbness of the tongue. You know that numbness of the tongue and slurring of speech is associated with hypoglycemia. Remaining are all the features of hyperglycemia. Question number 2. A 40-year-old man is newly diagnosed with type 2 diabetes mellitus. As a nurse, you expect the patient to be started initially on option A, diet with exercise regime. Option B, oral hypoglycemic agents. Option C, regular insulin subcutaneous. Option D, only diet modification. And it's type 2 DM, and the answer is option A, diet with exercise regime. The main problem of type 2 DM is tissue resistance to insulin, and it is ideally overcome by doing exercise. Also, modifying diet is of help. Question number 3. While educating a patient with type 2 DM, the patient asks about insulin injection needs in type 2 DM. As a patient educator, the nurse clarifies that option A, insulin is not used in type 2 DM. Option B, only intermediate insulin is needed. C, insulin administration stops pancreas release of insulin. D, insulin may be needed in illness surgery. And the answer is insulin may be needed in illness and surgery. Option D is the right answer. Question number 4. The typical features expected in type 1 DM are option A, thin hyperglycemic adult with ketosis. Option B, obese hypoglycemic with acidosis. Option C, obese hyperglycemic with hypokalemia. And D, thin elderly with glycosuria. The typical features expected in type 1 DM is the correct answer. Option A thin hyperglycemic adult with ketosis. Question number 5. A diabetic patient posted for nephrectomy is on nil per oral. The patient states he feels like lightheaded. The nurse checks the RBS and finds it to be 48 mg per deciliter. The expected nursing intervention would be to option A, administer dextrose 50% IV per protocol. Option B, administer 75 gram oral glucose. C, do nothing as it's normal. And D, continue monitoring RBS. And the answer is A, administered dextrose 50% IV per protocol. This is actually a previous year question paper. This question is taken from previous year question paper. Question number 6. The nurse is reviewing the results of the patients to be seen today. Which patient meets the diagnostic criteria for diabetes mellitus? Option A, a 40-year woman with HbA1c of 8%, a 50-year man with FBS of 112 mg per deciliter, a 70-year woman with RBS of 190 mg per deciliter, a 74-year man with 3R OGTT of 198 mg per deciliter. And the answer is option A 40-year-old woman with an HbA1c of 8. So remember the test criteria. This is adapted from WHO and International Diabetes Federation. Based on that, what level of HbA1c, FBS, or even oral glucose tolerance test OGTT or RBS is considered to be pre-diabetes or overt diabetes mellitus. Please study this criteria. This is very important. Question number 7. ACE inhibitors may be prescribed for the patient with diabetes to reduce vascular changes and possibly prevent or delay the development of what? Option A, hypertension. Option B, COPD. Option C, renal failure. Option D, cerebrovascular accident. And the answer is option C, renal failure. So remember, AC inhibitors increase renal blood flow and are effective in decreasing diabetic nephropathy. Question number 8. A patient with diabetes mellitus demonstrate acute anxiety when admitted to the hospital for the treatment of diabetic foot. What is the appropriate intervention to decrease his anxiety? Option A, administer anxiolytic. Option B, communicate with trust, empathy, respect. Option C, ignore anxiety as it's normal and will disappear soon. Option D, explain every medical terms used and the pathophysiology of diabetes. And the right answer is communicate with trust, empathy and respect so that you establish a relationship and a very good IPR. When you maintain, you can alleviate all their anxiety by like clearing the doubts and all. You don't have to explain every medical terms and the pathophysiology in detail. Instead, if you clear their basic doubts and communicate with them with trust and empathy and respect, is really helps. Anxiolytic is really not needed in this scenario. Question number 9. A patient is admitted with the diagnosis of DKA, diabetic ketoacidosis. The initial blood glucose level is 850 milligram per deciliter. A continuous IV infusion of regular insulin with normal saline is initiated. The serum glucose level is now decreased to 230 milligram per deciliter. The nurse would next prepare to administer option A, 50% dextrose. Option B, anti-seizure medicines. Option C, IV fluids with dextrose. Option D, NPH insulin subcutaneously. And the right answer is option C, IV fluids with dextrose. Remember, when the blood glucose level falls suddenly below 250 or even 300, the IV infusion rate is reduced and a dextrose solution is added to maintain the blood glucose level at about 250 at least until the patient recovers from ketosis and acidosis. The reason is when you try to reduce the blood sugar level suddenly and the CNS level or the CSF level of sugar is still high, there is always a possibility for absorption of fluid into the, because now the CSF or the CNS is more concentrated with sugar, and there is always a possibility for cerebral edema and CNS complication. That's why if the sugars fall drastically without the correcting the ketosis and acidosis, we try to give glucose simultaneously while giving the regular insulin infusion, so that steadily you will decrease the blood sugar level without any CNS complication. Question number 10. The nurse is teaching a patient how to load regular insulin and NPH insulin in the same syringe. Which action indicate the need for further teaching? Option A, withdraws regular insulin first. Option B, withdraws NPH first. Option C, inject air into NPH insulin vial first. Option D, inject an amount of air equal to the desired dose of insulin into each vial. So which is the wrong option is your question. So the answer is option B, withdraw NPH first. Why? Always remember, regular insulin or atrapid is a clear insulin, and NPH and other cloudy insulin or clouded ones, if you load first and then you try to load regular, you are actually contaminating the regular insulin. So the clear insulin cannot contaminate the cloudy ones, right? So the steps of mixing the insulin, or if you have to take two insulin together, what you will be following is roll and clean the insulin vial, add air to cloudy, or if you are using NPH and regular insulin, the intermediate acting insulin first, and then air into the short acting or the clear insulin, and withdraw insulin from the clear insulin and then the cloudy or the intermediate acting insulin. These are the steps, correct sequence of steps. Now, question number 11. While taking care of patients, the nurse is aware that the following is not a potential etiology of hypoglycemia in adult. Option A, alcohol. Option B, salbutamol. Option C, insulinoma. Option D, adrenal insufficiency. And the right answer is salbutamol. Salbutamol doesn't change sugar level. Question number 12. Which one is not the condition associated with metabolic syndrome? Option A, cardiovascular disease. Option B, insulin resistance. Option C, obesity. And option D, hypothyroidism. And the right answer is hypothyroidism. So in the metabolic syndrome, we have central obesity with insulin resistance, abnormal lipid levels, like especially a very low HDL, very high LDL or triglycerides, PCOD, type 2 DM, any oxidative stress with inflammation and very high levels of sugar, hyperglycemia, non-alcoholic fatty liver diseases, endothelial dysfunction and hypertension. These are the important conditions key conditions under the metabolic syndrome. Question number 13. A diabetic patient admitted with history of fever since 3 days and is with high blood sugar, metabolic acidosis and ketones in the urine. Also presented with polyuria, hypotension and Kussmaul's respiration. What could be the problem? Option A, hypoglycemia. Option B, HHNS. Option C, diabetic ketoacidosis. Option D, Somogyi phenomenon. And the right answer is option C, diabetic ketoacidosis. Question number 14. A diabetic patient with viral fever reports not checking blood glucose or regularly taking glimepiride. What condition is this patient most at risk for? Option A, DKA. Option B, HHNS. Option C, Dawn phenomenon. Option D, metabolic acidosis. And the right answer is HHNS. HHNS is more common among type 2 DM patients and the patient is taking OHA. So definitely patient comes under the category of type 2 DM. Type 2 DM patient when has some infection or stress or not taking adequate oral fluids, they are at risk for developing HHNS. Question number 15. Nurse is taking care of a patient with diabetic ketoacidosis with insulin infusion and current glucose level of 240 milligram per deciliter. The patient is also receiving DNS IV. His pH is 7.32, potassium 3. Which of the following is a concern? Falling potassium, option B ketosis, option C acidosis, option D dehydration. And the right answer is falling potassium. Potassium abnormalities like whether it is hyper or hypokalemia is always the priority of care. Here the pH is of concern, but it is not very low, but it should be corrected. When you have multiple okay answers or right answers are there, you have to choose the best or the better one from the options. Question number 16. What will you explain to the parents who do not want to give their child insulin injection because they have heard that pills can be used instead? Option A. Insulin is destroyed in the GIT if taken orally, so it must be injected. Option B. They can be taken oral medicines respecting their decision. Option C, the child cannot take the pills as resistance can develop. Option D, the pills are reserved for adults. And the right answer is insulin is destroyed in the GIT if taken orally, so it must be injected. Option A is the right answer. Question number 17. While taking care of a patient with alcoholic ketoacidosis, The nurse identifies the most common precipitant as option A, pancreatitis, option B, infection, option C, poor nutritional status with alcoholism, and option D, all of the above. And the right answer for this is all of the above. Remember, in case of alcoholic ketoacidosis, these three are the main reason for developing ketoacidosis. Which statement is wrong about the fluid deficit in HHNS? Option A, it is usually 5 liters of fluid deficit. Option B, normal saline should be given if in shock. Option C, fluid replacement should always precede insulin therapy in the non-shock patient. Option D, fluid replacement should be done over a long period of time than in decay. And the right answer is option A, it is usually 5 liters of fluid deficit. Why? Because in diabetic ketoacidosis, the fluid deficit is generally around 6 liters, and in HHNS, the dehydration is more severe, which could be around 9 liters. So here it is, this 5 liter can be approximated to DKA fluid loss only. In dehydration is in HHNS is much more profound, and sometimes the patient will be in severe shock. Question number 19. Somogi effect is considered to be a problem of option A, increased insulin resistance, option B, non-ketotic hyperglycemia, option C, early morning hyperglycemia due to nocturnal growth hormone, option D, overnight hyperglycemia with morning rebound hyperglycemia. And the right answer is Somogi effect is 2 to 3 a.m. hypoglycemia, which is overnight hypoglycemia with morning rebound hyperglycemia. Question number 20. Which of the following measures does not help to prevent diabetes complication? Option A, controlling blood glucose. Option B, controlling BP and lipid profile. Option C, eliminating all carbohydrates from daily diet. Option D, identifying eye or kidney problems at the earliest. Which does not help to prevent diabetes complication? And the right answer is option C, eliminating all carbohydrates from daily diet. Though the diabetic patient's problem is with controlling their blood glucose level, doesn't mean that they have to eliminate carbohydrate completely. They will be only modifying the diet, and they will supplement more protein and reduce the portion of carbohydrate. It's not possible to eliminate the carbohydrate completely. Remaining points are much relevant to diabetes complication prevention. Thank you so much. Prepare well for your exam.